Dr. Albert Gajdos. I graduated from Cardiff Uni in 2016. After that, did my VT in High Wycombe and moved straight into an NHS practice. I stayed there for a year, and after that went into private practice, which is where I am right now. I'm based here in Windsor in a clinic called Smile Rooms. It's a lovely clinic. We focus on private dentistry only, and my particular focus is cosmetic dentistry. So that involves things such as composite bonding, composite veneers, full mild rehabilitations, porcelain veneers, Invisalign treatment, and all things such as whitening, icon treatment, and other cosmetic treatments. To have the right mindset is really, really important for us as dentists because I think it trickles down into all other areas of our clinical practice. Okay, having a certain mindset or an approach to honing our clinical skills, for example, or honing our communication skills as dentists is really, really important. It is what allows us to continue to learn and continue to improve. And there is a couple of principles that I think I keep on coming down to and kind of have distilled over the years that have really, really helped me in my career. I think the first one is to have a growth mindset. So that means to be open to learning new things, essentially not thinking that you're the finished product or that you kind of, your skills cannot improve any further, but always knowing that you can push yourself further. The second thing is the 80-20 principle, or otherwise known as the Pareto principle. And that's basically a principle that dictates that normally 80% of your results come from 20% of your efforts. And the way I use that with composite is that I really noticed that there was a few really, really key things when it comes to, for example, composite dentistry that have made the biggest difference in terms of my progress and my career and my results with my patients. So I always want to think about that 20% and I want to master that 20%. And I also want to make sure I'm doing it consistently, because consistently, that is what is going to give me the best results. I think the final mindset principle is patience. I think in the modern day and age with social media and TikTok, our attention spans are just getting smaller and smaller. But I think having patience in terms of kind of your outlook and your career really, really pays off. And what I mean by that is that, for example, when it comes to practicing certain things, either becoming good at composite or becoming good at porcelain veneers, it takes years, often years of practice. You just have to do the hours, right? And I think being patient and knowing that, it's all going to come for you, and your time will come. You may start somewhere, right? You may not be there yet, but your time will come. And I think that's also really, really important, just to have that patience to kind of push through and persevere. So when you think about anterior composites and you look through research, randomized control trials, you'll find that there's 4 key challenges when it comes to long-term success of anterior composites. And those challenges are, first of all, chipping, staining, control over color, and control over the shape of the composites. So chipping is a common problem with composites, and the reason is that the composite resin isn't as strong as natural enamel. But there is a few things that we can do as dentists to help minimize that risk as much as possible. I think the first thing is to actually ensure that we are mindful of the occlusion that the patient has. Second of all is to be mindful of the materials we're using. We need to use the correct type of composite on load-bearing areas. And third of all, we also need to be mindful of our bonding protocol. Okay, so essentially what that means is we need to be mindful of how exactly we bond the resin to the teeth. Okay, and there's a few steps involved there. I think we cover everything on our course actually to ensure that you're getting the best possible results in all 3 of those factors. The biggest challenge with color is that every patient has got teeth of different colors. Okay, so that's the first challenge. The second challenge is that actually there's so many different composite systems out there, and all of them have slightly different shades. So I think in terms of actually tackling that challenge, it's about selecting the shade of the composite in the right part of the tooth. Okay, so doing your shade matching correctly at the beginning of the procedure, that can help you ensure that you get the right shade. But also it comes down to using the same composite system consistently. And sometimes that means for months, sometimes it means for years. I think the more you use a specific system, the better and better you'll understand it. The better you understand how the colors, the opacities and the translucencies blend with that natural tooth. And when you do understand it, it becomes a lot easier to consistently select the right shade and consistently get the best results in terms of color matching of your composites. Staining, a really common concern with composites. There's different types of stains and they can occur for different reasons. I think the first thing we have to be mindful of is we have to ensure that we're using the correct bonding protocol. We're using all of our etch and bond in the correct way and fashion. Because actually composite that's not properly bonded to tooth structure can stain very easily. The second thing is we want to avoid any rough or unpolished surfaces of our composite. And I think the common concern there is the interproximal areas of teeth when people come to kind of shape those and polish those. Obviously on our course, we cover all of this to ensure that they're getting the best possible results and minimizing staining as much as possible. I think when it comes to composite, shape is actually the most important thing, okay? Most people focus on shade and sometimes patients do, but getting the correct shape of your restoration is the key factor, okay? Because that's immediately what's obvious to our human eye when we look at a tooth. So how to do that? I think first of all, we want to work with the right type of composites, okay? If we're able to handle the composites well, we're able to actually, shape them onto the tooth surface in a more precise way, more precise fashion, and therefore getting us a better result when it comes to actually finishing and polishing the resin. But as I'm leading on to there, shaping, finishing, and polishing is the second bit, and probably that's actually the most important bit. Knowing exactly what tools, whether it be soft flex discs, special burrs, discs, or polishing systems to use, how to use them, and where to use them in order to get the most beautiful natural anatomy. At our clinic, we often focus on giving our patients a multi-unit, comprehensive approach to designing their new smile. And the reason we do that is because we don't just want to make their teeth pretty. We want to enhance their overall facial appearance. Okay, and patients often they don't look at their teeth as closely as we do as dentists. Remember, they don't have loupes at home. More what they're sort of interested in is how good they look in photos, how good they look in the mirror when they're trying on a new outfit, for example. So I think those are just instances, but I think that's where the magic happens. Often treating just one or two teeth isn't going to make a significant change in the patient's appearance and in the patient's life. As for most patients, they're actually the dental issues may be more widespread. So here we want to have a really comprehensive approach to treating those patients. In terms of smile design, is driven not just in terms of their dentition, but also facially to ensure that they're really getting the best possible result. I think most commonly it involves what's called align, bleach, and bond. And basically that, first of all, involves using Invisalign to straighten the teeth, then using some tooth whitening and tooth bleaching to whiten and brighten the teeth, and finally to do any kind of contouring or reshaping of the teeth, either by doing some sculpting or by doing some composite bonding. A couple of considerations when it comes to actually choosing our composite material. I think number one overarching thing is the handling of the material. Really important. If you can't maneuver the material in the way and the shapes that you want, you're never going to be able to get a good result with your resin. So that's number one. Number two is strength. So obviously composite is never going to be as strong as real enamel, but we want to get as close to that as possible to ensure that the restorations that we do for our patients last and have the strength to withstand, the general day-to-day wear and tear. And the third one is color and polishability. So obviously composite needs to be a very close match to all the natural characteristics of a tooth, all the natural colors that are found within the natural tooth. and it needs to be able to polish in the same manner and fashion as the natural enamel surface does. When you think about composite, right, often there's so many techniques and so many steps to each and every technique. I think every time that you introduce a step, you're introducing room for error. Okay, so I think for me, it is very, very important to have a simple step-by-step approach with as few steps as possible, because that actually reduces the chances of you introducing an error. Okay, if you can really distill something down to its simplest form, it's much, much easier to understand, it's much, much easier to reproduce, and it's also much, much easier to get a very good result. Well, I can think of three. So the first one is genial accord. Second one is genial anterior, which is kind of the same material. The accord is the newer version, and those are packable composites. And the last one is genial universal injectable. I think it's sort of a composite that I started on that really got me into composite bonding. And the standout quality of that material is how easy it is to handle. Obviously, when I was new to the field of composite bonding and composite veneers, naturally you struggle a little bit, right? And I think the genial material made it so easy for me to get a good result from the get-go. So I think that made the biggest difference for me. But also to mention that, the kind of the color properties of the material were really, really good. It's a material that just seamlessly blends with most parts of the tooth, which just really simplifies the approach of us doing things like edge bonding or composite veneers. Genial anterior was actually the kind of the original material that was invented many, many years ago. A very, very good handling, color properties of the material. That material, however, is a microhybrid composite. Okay, so what that means is that actually the composite, the little resin particles inside the composite are really quite large. And that allows the material to have substantial strength. However, it may not be able to achieve the best possible polish. Now, the accord is a next generation material which actually builds on that genial anterior system, which many people really, really love. It produces the same optical properties, same color properties, but it's got a few benefits. It's a nanohybrid, so actually the kind of the particle size within the composite matrix is much, much smaller, so you get a much, much better polish, much, much better polish retention, and also the material features a natural fluorescence. So that's a really key feature. For example, when you have a patient that maybe goes out and they spend a lot of their time in clubs, maybe they're DJs or yoga instructors, often they'll find in the UV light their composites will shine really, really bright. Now, genial accord doesn't do that, which can be a really, really good thing when you have these sort of patients coming in. You can offer them something that really rivals a natural tooth. I would say, both the genial anterior and accord are pretty easy to shade match. And certainly I've worked with these systems for over 5 years and the shades are pretty forgiving. Okay, so, you can put a B1 genial composite onto a tooth that's maybe A1 or A2, and, you can get a very, very good color match still. But the accord system especially, that takes it to the next level. And what they've done there in the accord system is that they've actually taken out a lot of the shades. So, for example, shades like B1 have now been taken out of the range, and instead we've been presented with a composite that's just A1, A2, and A3. And that A1 composite, for example, can be used on many different shades. So you can use it on teeth that are, B1, for example. You can use it on teeth that are A1. It's a value-based system. Okay, it kind of matches the value, the kind of the color brightness of the tooth rather than the color, because it has some chameleon effect properties in it. I think genial universal injectable has really changed the way that injectable composites are viewed. Firstly, it presents an injectable composite that has a really, really high filler content. And with that filler content, we're getting a lot more strength. We're getting a lot of fracture resistance from the injectable composite, but also a lot of wear resistance. So, for the first time, it's a composite that can be used on load-bearing areas, an injectable composite that can be used on load-bearing areas. And it's a fabulous material to use. We use it for all of our, for example, diastema closures, fixed retainers, attachment placements, because of these high strength properties. But also, and probably more importantly, to kind of further the dental development in the dental community, it's also the composite of choice for injection molding cases, which allows people to produce really nice, beautiful, reproducible results for their patients. Injection molding has become really, really popular over the past few years. And thanks to composites like the genial anterior, genial universal injectable, I think the technique it's a really, really great technique to have under your belt, because it allows you to produce really reproducible results for patients. So now with this system, you have a system whereby you can get a wax up, you can do a mock-up for the patient, and then you can actually reproduce that one-to-one on the patient's teeth. Which is really, really great, because the patient really knows, and is consented properly, and they really know what they're getting into, and you can actually produce that for them, which is, I think, amazing. But I think what's also important is where we are maybe doing slightly trickier things in terms of the occlusion. So things like dull cases or wear cases, where we're actually trying to reproduce a specific occlusal scheme, which we've planned using, our articulators and our lab staff. We can actually reproduce those exactly into the patient's mouth. And what that means is that we're going to need less occlusal adjustment, and we're actually going to have a much, much better fitting occlusion and final result for the patient. I think another sort of favorite from Genial is the G multi-primer, and that's basically a silane coupling agent, a silane primer, and we often use that for composite repairs. So you can use that once you're repairing a fractured composite, or you're adding to already pre-existing composite restoration, and you just use it just before you apply your adhesive or your bond. And that's a really, really great material, because it allows you to reactivate the surface of the previously inactive composite, and allows you to get much, much better, stronger bond strength to existing resin. We run a 2-day maximum hands-on Simplifi Composite Course, and that course basically covers all things composite bonding and composite veneers. So it includes teaching the delegates techniques such as single shade composite veneers, layered composite veneers, class 4s, edge bonding, and diastema closures, peg laterals, basically everything there is to do with anterior composite bonding. So it's a 2-day course. Most of the course is actually hands-on practical, which is really, really good, because as dentists, I think we need to really, really hone our practical skills in order to really get good at something, proficient and confident at doing these procedures. All the delegates get a Simplifi hardcover book as well. So all of the protocols that they learn on the course, all of the intricacies of how, where to place the composite, what composites to place, everything is packaged into a nice, hardcover book, so they can take that home with them, keep it in practice, make sure that they can really apply the techniques and access them later down the line. We also do videos as well, so all the delegates get like additional post-course videos. Now they're slightly different to what we learn on the course, but some of the techniques overlap. So it can serve as a really, really good reminder of kind of what they covered on the course, but also they can take their learning to the next level and learn additional techniques that are available to them in that video bank. I think the very, very unique thing about the course we run is that we actually offer 24/7 WhatsApp support groups for all the delegates. Okay, so that's all included in the course. And actually, that's where I find most people get kind of the most value from, because when they go back to practice and they got that first case coming up, or they're really stuck with something, they can just message across and we'll be there to answer and help them out. And I find that it really sort of forms a community almost, right? It's not just a course anymore. it's formed almost a community of all of the alumni and the graduates, all of us, the tutors on the course, which is actually really, really nice. As well as the 2-day hands-on flagship course called Simplifi Composite, we also offer a course called Simplifi Live. And that's a really, really unique, a really intimate experience whereby only a few delegates that have previously completed the flagship course can come into the surgery and actually learn from me right here. And together we do a live case. So there's a patient coming in and, we're doing either 6 teeth or 8 teeth, a combination of composite bonding or composite veneers. It's all streamed live on a big TV. And, they can really see those intricacies that come into play when you're treating a real case. I'm super excited to be holding a hands-on workshop at the BACD this November. And the workshop is going to be in the classical Simplifi style. So in the workshop, we're actually going to take some of the harder things to do when it comes to composite dentistry. We're going to be discussing a discolored central and a class 4 restoration on the lateral incisor. So really, really challenging techniques. But I think the key is, and what I want people to get away with in the workshop is, I want to really distill down what's the sort of the important techniques when it comes to doing these things. And I want to simplify these two really, really complicated areas as much as possible so that people can achieve predictable and reproducible results every single time. It's a hands-on session. Most of the session, in fact, will be hands-on, which is really, really important. I think, in dentistry, we're hands-on professionals. That's how we learn. And so I would say 95% of that session will be hands-on. A couple of things. I think in terms of cosmetic dentistry, I think the trend is towards minimally invasive dentistry. And I think what's driving that trend is actually composite, right? Composite materials are getting much, much better day by day. So the materials are now polishing much better, exhibiting less staining, better optical properties and color matching properties, and better strength in terms of actually chip resistance and wear resistance. So composite is now becoming more and more of a long-term material rather than a second-grade material to porcelain, which I think for patients especially and for the health of their teeth in the long term is probably the biggest breakthrough. So the second thing is actually injectable composites. Now with the new injectable composites such as the GUI, Genial Universal Injectable, they're getting stronger and stronger and better, which actually allows us to expand the remit where we can use these injectables in terms of their application. So we can now use them on load-bearing areas or occlusal surfaces, which is amazing because placing an injectable composite in many instances can be much, much faster, much more time efficient than using a packable composite. So I think that's also going to change the landscape of composite and minimally invasive dentistry.